Welcome to the HiFLEX Health and Performance Podcast, where I'm your host, Dr. Chelsea Smith. We'll be talking about all things physical therapy, where we believe an almighty God created us to move and to be able to heal. Join us as we talk through whole body health, pain relief, post-surgical rehab, life lessons we've learned, things we repeatedly tell our patients, and the list goes on. All right, welcome to episode 4. What I want to talk about today, and this won't be a super long one, is home exercise program. Super exciting, right? So this is a big one that is pivotal in the process. It can seem super mundane and boring sometimes if there's not an understanding and education behind why you're doing what you're doing. And even then, sometimes it's the reps in the tank that you just need to do. There's other things in life that we just need to do if we want to feel a certain way or have a certain outcome. And so I think this is an important topic to really just get a thorough understanding from a personal standpoint of mine and from my team. I know they're in agreement, but just why we tell you to do certain things and why it matters if you do it, or if you don't do it and you relay that information to us, why that's important. So home exercise program, what this typically is and how we craft it up and what's going on in our mind when we are deciding, hey, I want, Mr. Smith to do these 5 exercises at home. There is a whole lot of brainwave going on while we're evaluating somebody or while we're reassessing them, maybe in a follow-up visit if we're going to tweak it. What we're looking for ultimately is a deficit of some kind or a function that is not moving optimally. So I'll give a common example because I personally treat a lot of neck and shoulder pain. Shoulder blade mechanics or shoulder blade control or just strength of the muscles around the shoulder blade. So if I am assessing somebody and I see, okay, this shoulder blade is supposed to be able to upwardly rotate. So if you can visualize a shoulder blade right in front of you and the bottom corner of it is rotating up as an arm goes overhead. That's what we consider upward rotation. Downward rotation, more so that bottom corner of the shoulder blade, it's going to move towards the spine. The shoulder itself is going to look like it's moving down. If I notice that somebody does not have great control of their upward rotation, maybe their upper trap kicks in a bunch and it's kind of this fighting motion, in my mind, I already know, okay, things that I need to work on with this person are activating the lower trap. And for those of you that are listening and you don't have a visual, that's okay. Just work with me here on the concept of it. I am looking in my mind at I need to strengthen the things that help upwardly rotate this shoulder blade. And in that category, there is a slew of exercises that I could choose from. Anybody who has ever consulted YouTube or Instagram has seen that there are tons of exercises. Now, there's not one magical exercise that's going to be the exercise, even though we've all seen those reels right now that are like, point of view, you start doing this one exercise and all your shoulder pain goes away. Maybe that's the case. Maybe there is one that really makes a huge outcome. But I think more so what it should say is you consistently do something different. And over time, that consistency gives you a result. We just have a library of things that we can choose from that we know in a category that we're going for. So let's go back to the concept of home exercise program. If we do hands-on modalities, if we are working on soft tissue for you, if we are working on your nervous system, if we are mobilizing certain joints, if we are doing things that help control pain and help promote movement better, that's awesome. And you may feel better. But those things got there for a reason. And if we don't spend time consistently working on the opposite of that to then lock in the improvements we've made in pain level and movement and mobility, then we're not doing our due diligence to you, getting you the best long-term outcome. And so this is no knock on any other profession that is more passive-based, but and I personally get massages. I have nothing against massages. They feel great, but that massage is going to take my pain level down. It may take my tension levels down, but it's not going to make something move better and stay moving better and be more stable, right? So same concept with certain chiropractors. Some chiropractors are a little bit more on the passive, and they are just working on getting spinal segments to move better, have better feedback from the brain. And then that alone is not going to keep that change. Some of them will give a home exercise program. Sometimes massage therapists will suggest stretching or, something like that. But ultimately, where I feel, obviously I'm biased as a physical therapist, where we get kind of this best of both worlds is we're able to do all these passive things and then transition in the session into active movement. And then a reflection of what we do in the session in kind of a miniature form is what we ask you to do at home. Maybe it is working on that low trap muscle that I was talking about that helps upwardly rotate the scapula and tip it backwards, the serratus anterior that helps to bring it around the rib cage. Maybe it's, hey, we're going to do all this stuff in session to help loosen up that blade, to help your upper back move better, but I need you to go home and consistently every day, or what I tell a lot of my patients is, hey, majority of the days of the week, like, let's be realistic. Setting a goal of every day sometimes for people is intimidating, and if they're all or nothing folks, they're like, well, can't do it every day, and I'm just not going to do it. Majority of the days of the week, and fit it into small windows of time that you have. You don't have to sit down and do a whole workout, but it takes reps. Science shows, even outside of science, people are like, I don't really care about science. Just anecdotal in your own life. If you've gone to the gym or you've tried to make any kind of strength gains or improvement in cardiovascular fitness, it takes time. It takes consistency and time. So the home exercise program is for you to really drive in to your motor control, to your just ability to make something seem more of a normal movement pattern and to build that strength. What I see is often where people have gone to a different clinic. And when I say different, I'm not meaning different in the same kind of style as us. Different being a busy clinic where maybe they haven't had a lot of time with the therapist and they're just given kind of a standard, hey, you have back pain, here's your home exercise program. And it's what everybody with back pain might get as their intro exercise program. That I often find does not have great buy-in. I think they actually did a study and only like 10% of people that go to physical therapy actually do their home exercise program consistently. And most people stop doing it if they're given more than 3 exercises. So we do try to take that into account and not overload you with like 10. But I do think in this setting, when you have that much time with us to be able to work on something, giving you more in that 5 to 6 sometimes, a couple of them are always going to be really, really short. Like it takes a nerve glide, maybe, to do 10 to 15 reps, we're talking less than a minute. So your list might include that and it might look like, oh, there's 4 or 5. But if one of them is a nerve glide, crazy short. If one of them is just a repeated spinal movement, also really short, less than a minute. Then if we're talking about, maybe 3 sets of 10 of a certain strengthening exercise, that may take a good 2 minutes. So if we have 3 that are in the strengthening category, we're talking maybe 2, 4, 6 minutes, 7 minutes adding in a nerve glide, maybe 8, 10 minutes tops sometimes to be able to go through this. Now, if you're returning to a sport, might look a little different. Might take more of a 30-minute window to get a true kind of workout feel, but it's the consistency that matters. So not to beat a dead horse, I kind of hate that phrase. It seems so gruesome, but we don't ask you to do things for no reason. We don't want to waste your time by any means. And to get the long-term outcome, it takes more than just what we're doing in the clinic. Now, other things that I can tell you as a personal patient, I think every PT and therapist in general is probably a patient in some regard anyways. So when I am working on stuff, and I'll use my neck and upper back as an example, a lot of times my homework for myself is just mindfulness of kind of reassessing, is this moving well? The past episode 3 was on touching base with baseline. If I've kind of gone through this general screen of like, oh, interesting. It's been, a week or 2. I've had to carry my baby on my left hip for a while. My shoulder's a little bit tight. Now when I'm going through some of my just kind of baseline movement patterns, I'm noticing some zones are stiff. So sometimes my home exercise program for myself is just simply being mindful of areas that don't move really well and spending 3 to 5 minutes making sure that area moves well. Okay. I want to keep this one less than 10 minutes, but this is just to say, if you are given a home exercise program and you look at it and you're like, this is boring, or I don't see the point in this. If you don't see the point in it, something was lost in education. You should be going home with, hey, in this session, remember when we did this exercise and what it felt like and where you felt it. Great. When you're doing your exercises at home, we're looking for that activation, that sensation, for the goal of XYZ that we've explained in a session to you. If you're looking at your sheet of paper and you're like, why am I doing this? This looks like a waste of time. We have failed you. If you have been explained that and you just simply aren't motivated to do it, look at the investment of time and money that you're doing with physical therapy, and you owe it to yourself to get the best long-term outcome and be an active participant in your care. And so it's just a personal accountability call of, hey, you want to feel a certain way, and in order to do that, I need you to actively be a participant, whether that's setting an alarm on your phone or, maybe multitasking, habit stacking, however you want to look at it, of while I'm in the floor playing with my kid, I'm going to try and knock out 2 of these exercises, showing my kid, hey, mommy or daddy is going to be consistent in this, whatever that may be. Maybe that's at work. I have a few people for their neck home program. They have a certain mobilization that they're doing with a towel or a pillowcase. They sit it right on their desk. Hey, if you've been at your computer for an hour, number 1, please move positions. I am not a posture obsessive person. I am your best posture is your next posture. Let's move out of that position. If it's been about an hour mark, maybe you set a little timer on your phone, maybe whatever. You grab your pillowcase, you go through a few of your mobilizations, you get up, you take a couple-minute walk down the hallway, you come back. That can be game-changing versus, I don't really want to take the time. I'll just wait till the end of my workday. And then you get home and things are busy. You got to cook dinner. And then all of a sudden it's bedtime and you haven't done anything. So intentionally habit stack, whether it's, okay, whenever I go pee, I'm going to, right when I'm back from a restroom break, I'm going to knock out a few of these exercises. Whatever it is, just know we do not give you things for no reason. They are important in your care. And if you do not understand why they have value, that needs to be a conversation that you would take back to your therapist. If that's us, we're happy to go over it. If you're going somewhere else and you're just listening to this podcast and you're like, interesting, I really don't know why I'm doing this. If you are not bought into a home exercise program, you are not going to do it. If you do not get your home exercise program consistent, you might still get better. You just might not get the long-term outcome that you want and deserve and should get with your financial investment and your time investment in therapy. And we all want that for you. So, okay, I hope this was helpful. I know it's a little boring of a topic, but it is one that is so drastically important. And it just builds routines. It builds routines that, people always ask me, am I going to have to do these same exercises like every week for the rest of my life? Most of the times, no. You're going to get in a groove, you're going to feel better, and you're going to be able to implement them in a warm-up of an extra or in a workout program, or you're going to have them in your arsenal of when something starts to flare, hey, I'm going to go right back to these things. In some cases, yeah, you might need to do them on a regular basis indefinitely to keep that outcome that you're looking for. But ultimately, it's a small sacrifice to make for quality of life. All right. I hope you guys have a fantastic day, evening, morning, whatever time it is. And I will be back with episode 5 soon. I'm going to hit a button that I don't know if it's the right outro music. I can't remember where I put it. It's not that one or that one. Listen to me go through all of these. We're going to get it. We are going to get it. Maybe we won't. You know what? Find me at my website, HiFLEXhealth.com. And our social media is HiFLEX. You can search that and you will find us. You can email me, Chelsea@HiFLEXhealth.com, and you can just laugh with me that I have yet to memorize my podcast board. I'll see you guys next time. Bye.